Purposes: dredge channels and collaterals and relieve the back's chronic disease. Items to be prepared before treatment: massage oil, radiofrequency cream, and towels. Treatment time: 45 minutes. Let the client change clothes and ask him to lie on his stomach on a bed. Massage: 15 minutes to relax the client and help him dredge channels and collaterals and accelerate blood circulation. Apply massage oil to your hands, rub the client's whole back with them till Fengkai, GB 20, and Fengfu, DU 16, and press the 2 acupoints, repeat 3 times. Push to meridian with your hands alternating, repeat 3 times. Push bladder meridian with your hands doing it by turns, repeat 3 times. Push from Das Hui, DU 14, to do meridian and bladder meridian with the base of your palms, respectively, and lift from the waist side till your palms slide out from the armpit, repeat 3 times. Push from the back of the neck to anadesma, connecting the neck and shoulder with kneeling fingers, repeat 5 to 8 times. Push from the back of the neck to the waist inch by inch with kneeling fingers, repeat 3 to 5 times. Stroke anadesma, connecting the neck and shoulder with the first web space, and caress it with the other hand, repeat 5 to 8 times. The other side applies the same technique. One side, push the whole medial border of the scapula with your 2 first web spaces alternating, and repeat 3 to 5 times. Push from the medial border of the scapula to the shoulder with your hands alternating, and repeat 3 to 5 times. Move from the arm to the palm along the shoulder and slide out. The other side applies the same technique. One side, stroke bladder meridian transversely with your thumbs, and push from the medial border of the scapula to the waist, repeat 3 to 5 times. Caress from the waist side to the shoulder with your palms alternating. Press Jianjing, GB21, slide out from the arm to the palm, repeat 3 times. The other side applies the same technique. Clean the back with a towel. Electric artery sucker, to enhance blood circulation, relax muscles, and relieve the back's chronic disease. Parameters setting. Operating time, 20 to 30 minutes, energy level, 3 to 7, temperature, 2 to 5. Start from the lowest energy level and gradually increase it but cannot exceed the client's bearable range. Wet the electric artery suckers 2 sponges and dry them. Pinch the sucker with your thumb and index finger and attach it to Jianjing, GB21. Do it to Jianjing, GB21, on each side. Fasten EMS pads onto back shoe points, BL11 to BL28, with a strap. Press start. Remove the strap, EMS pads, and electric artery suckers when time runs out. Clean the treated parts. The treatment lasts 60 minutes. It's advised to take it 2 to 3 times a week, and 12 sessions is a course of treatment. Contraindications. Women in pregnancy or breastfeeding. With heart disease or a heart pacemaker. With unhealed surgical wounds or in surgical recovery. With epilepsy, severe diabetes, hypothyroidism, malignant tumors, etc. Those with skin diseases or infectious diseases should use it with caution. Matters needing attention after treatment. Do not wash with overheated water or enjoy a sauna or hot spring within a week. Take a shower after 4 to 6 hours. Keep warm, do not drink cold, or expose yourself to a windy environment and catch a cold. Drink more warm water to replenish moisture and accelerate metabolism.